Greetings and welcome to PBH 205 at UNLV. Today's lecture is going to cover historical perspectives in public health, what we've learned from the past, and maybe it will give us a hint as to where public health is going in the future. As will be discussed many times in the course of this semester, public health does go hand in hand with medicine, but is also a little bit different from traditional medicine because public health deals with the health of communities and populations, whereas medicine, in general, only deals with the health of individuals. This will be clarified more in coming lectures. So I think it's important to cover public health, at least briefly, the history of public health, because the history of public health helps us understand how societies have conceptualized and dealt with disease, outbreaks, other negative health outcomes within their communities. You will also see that public health has evolved through trial and error. There were a lot of things that were tried in order to benefit the population that didn't work very well. But as scientific knowledge expands, we are able to fine-tune our public health a little bit more and apply it in a little more effective way. We also find out that unfortunately one of the greatest stimuli for public health are events such as natural disasters and wars, mass casualty events that also displace large percentages of populations and cause conditions that can quickly devolve and deteriorate so that public health interventions are needed more than ever. What we'll also see is that religious and societal beliefs have both influenced and at times repressed the development of both individual health and medicine and also public health. For as long as people have existed, we have had to deal with disease states where our body is not functioning the way that it should. There's something that has gone wrong. Many early cultures believed that disease states were due to the supernatural. Therefore, they relied on rituals and ceremony in order to try to reverse disease states and get the person back to a better health, or the community in the case of a disease state that was infectious. Some of the earliest people that we have recorded history of actually had some fundamental sense of sanitation and hygiene. It appears from a lot of the records that we see that very early societies understood that you had to keep your waste materials separate from your food and water, and that if you didn't store food correctly and allowed it to putrefy, that it would cause diseases and other negative health outcomes. From like 2500 BC, we know that some of the early Mayan civilizations were actually treating wounds, like lacerations and things like that, through herbal remedies and natural remedies. They also understood how to set fractures, how to suture wounds, meaning basically early stitches, using human hair. They also understood that food could be medicine. Things such as chia seeds and cacao were used medicinally for many years and generations. Some of the understanding of disease states that we still have to this day actually came from what we now know as the classical period, where many Greek, Roman, and Islamic civilizations were flourishing, maybe not always at the same time, but at different times. They were all taking turns being some of the culturally dominant civilizations of the world. As one example, there's Hippocrates, the Greek physician, and this is a translated quote from him, based on his many years of observations. If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. Whereas he was connecting diet and exercise to health, way back 400 years before the Common Era. Another example is Galen, who was a Greek physician who lived in the Anno Domini, or after Common Era period. He brought understanding of how various body systems worked through post-mortem dissections mostly, but also from studying of some living subjects. He also performed the first successful known cataract surgery that enabled people who had these cloudy opacities in their eye to be able to see. And again, we're talking about the years 120 to 200 is when he lived. For an example of one of the great advances that came from the early Islamic civilizations, we can look at Razis, a Persian physician and pediatrician who lived between the years 854 and 925. He helped develop these brand new sciences of psychotherapy and also of pediatrics, recognizing that children responded differently to treatments and to diseases when compared to adults. Razis was one of the many bright Islamic physicians who brought the translated knowledge from Greek and Roman medicine eastward into Iraq and Syria and places that we now know as the Middle East. This is especially important, as we'll talk about in just a second. Besides the advances in medicine, these Greek, Roman, and Islamic cultures also gave us advances in what we now recognize as some rudimentary public health things. They gave us advances in water and waste systems. Again, they figured out how to harness relatively clean water from mountains and other places and use it for drinking, and to keep wastewater and waste systems separated from this. On the left, you see a picture of a very early Greek toilet. They also advanced concepts of personal hygiene, noting that the cleaner you were, the less likely you were to have certain disease states, and that in some of the areas where people lived in high density, there were more problems with disease states, and so they encouraged people to try to live in lower densities. They also recognized the importance of protecting food and water supplies. Again, these were actually great public health advancements that occurred well over 2,000 years ago. Those of you whose study of history has been focused a lot more on American history and on European history, what we traditionally call the West, you probably will remember that there was a period of time from around the years 500 to 1000 that was known as the Dark Ages. This is after the Roman Empire had fallen in the global West. Now, that's a little bit misleading because actually this was not a Dark Ages at all in the Middle East. There's many areas that came under the conquest of Islam actually had a continuation of the Greek and Roman teaching in health, the ones that were forwarded by people like Razis, as we said earlier. So during this period, a lot of the advances in medicine and public health, a lot of the continuation of the early Greek and Roman advances were actually happening in Islamic civilizations in the Middle East. But in Europe, unfortunately, it was kind of a difficult time. This was a time when a lot of Christian and pagan ideals were getting integrated into ideas of medicine and public health. There was a big mass movement at the time of a religious movement and a belief that the body and spirit were two separate things, and that you really needed to focus on caring for your spirit, and that the body was really unimportant. And as a result, a lot of advances in medicine in Europe kind of ground to a halt at this time. And in fact, disease state was seen as a punishment for sins, that if you were sick, rather than considering hygiene or sanitation or medicine, you should consider prayer and penitence. And that medicine itself should be guided by church doctrine, because if it was not, then whatever medicine you might be prescribing, you might be interfering with God's will in that person's life. So as you can see, in Europe at least, it really was kind of a dark ages, and health did take a step back. Around the year 1000, Europe, or the Western world as we often call it, did begin to slowly pull itself out of the previous period of unenlightenment and suffering. This was often called the Middle Ages now. Now, new diseases emerged during the Middle Ages, partly because of population increases, increased trade, commerce, and travel, but also because of crusades. One thing that emerged from the Middle Ages was the miasma theory. This is the idea that diseases such as cholera, chlamydia, or bubonic plague were caused by miasma, or bad air, also known as night air. And we know now that this is not what actually caused these diseases, but it was actually good for people to think that bad air generated from dense living conditions or overcrowding or not properly treating waste was something that needed to be avoided. because by doing so, you were avoiding the microbes that were actually causing a lot of these diseases. So again, it was an idea that it was incorrect, but it actually led people to some actions that were beneficial to health and public health. There still were when people came down with infectious diseases such as leprosy, they were often cast out of society, which again did protect the rest of the population, but it wasn't a very humane method of taking care of the infectious disease problem. One of the great infectious diseases in human history occurred during the Middle Ages, the bubonic plague, also known as the Black Death. As a result of the bubonic plague, there were isolation laws put into place, kind of similar to the laws that existed already for leprosy. There were some attempts to quarantine people with plague into isolated villages. The focus was on the infected people rather than on the source, because at the time, people didn't know that there was actually a microbe that caused the plague that was spread by fleas and by the rats that the fleas fed on. So people focused on the infected instead, isolating the infected away. It's estimated that on the Eurasian megacontinent that as many as 2 million people might have died of bubonic plague back in the 1300s. If you want an illustration of the success of public health measures, this is one of the most profound ones you can see. From around the year 1000, you look at the world population. Back then it was like much less than 1 billion. And you see at the end of the 1300s, there was a pretty serious dip in the population as a result of the bubonic plague. But then, from that period on, a steady rise in the population. And then, by about the early 1900s on, just an exponential increase. Much of that is due to improvements in sanitation, in clean drinking water, in many of the things we now associate with public health. Some of it was due to medicine, but most of it was due to public health. What followed the Middle Ages were what we now call the Renaissance and the Enlightenment, the 17th and 18th century, also known as the 1600s and 1700s. During this time, there was even more increases in commerce and industry, more contact with the East, not just the Middle East, but also the Far East, eventually brought new ideas on health and development of medical schools. Again, in both the Far East and the Middle East, there hadn't been a Dark Ages. There had been more or less steady progress on many of the illness and public health conditions that were existing all over the world. The microscope was invented by Anton van Leeuwenhoek during this time, which enabled people to finally isolate and see the tiny microbes that were actually the source of many infectious diseases. There was a new focus on science during the Renaissance period. There was value given to scientific observation, that rather than just guessing or listening to what your priest might say is the reason for things, actually do scientific observation and attempt to find non-spiritual explanations for illness and public health problems. This search for scientific answers also coincided with a period of time when this idea that diseases were a punishment from God was beginning to become less favored, and a lot of people were starting to embrace the concept of deism as the concept which was explained by Thomas Paine in his book, The Age of Reason. Deism being this idea that there is a supreme creator, but that creator does not interfere or intervene in the machinations of world events. The observation and systematic testing of ideas were given greater value. There also were advances in mathematics. Again, this was because of a little more contact between the West and the East. A lot of the Islamic concepts of things like algebra actually came to the West and helped us know a lot more than we knew before. And some of the first applied epidemiology. Again, we're going to talk about epidemiology more over the course of this semester. The word essentially means study of epidemics, but really it's a study of the determinants of any kind of state of ill health, be it a disease, accidents, whatever it might be. We're going to talk about some of the pioneers in applied epidemiology. First, let's talk about a disease state that was very common, especially among sailors and other people that spent a lot of time out at sea in previous centuries. Scurvy. It's a condition characterized by general weakness, anemia, gingivitis, and skin hemorrhages, resulting from a lack of ascorbic acid, which is found in vitamin C. Scurvy is now most frequently seen in older, malnourished adults. It's not the same problem that it was in the 15 through 1800s. The reason why scurvy is not such a problem anymore is because some of the pioneering work of Captain James Leand, a Scottish physician in the Royal Navy. Back in 1747, he developed a hypothesis on what caused scurvy. He believed there was some kind of vitamin or mineral or some other deficiency that was causing it. So he actually did a dietary clinical trial. He gave 12 sailors 6 different diets. The 2 sailors who were fed a diet heavy in citrus recovered from scurvy in 6 days. The other sailors remained sick. We found out that later on, of course, that yes, the fruits high in vitamin C, such as lemons and limes and other citrus, would prevent people from getting scurvy if they were given on a regular basis as part of the diet. It took a little while for Captain Leand's idea to actually become Royal Navy policy. Almost 50 years later, it became the official policy of the Royal Navy that any sailors who were going out to sea for extended periods of time, part of their everyday rations would be lime juice that you would take every day to prevent scurvy. What this change in Royal Navy policy did was it improved the health, and it doubled the time that ships could remain at sea. You didn't have to come back to port so quickly because of your sailors getting sick. This helped conquer the armies of Napoleon. The year after the Royal Navy introduced lime juice and the sailor rations to help prevent scurvy, and an English physician named Edward Jenner started investigating smallpox. Smallpox was a deadly viral disease and also very dreaded because it was highly contagious and it was not fatal every time. Some people did recover from it, but it could be debilitating for those who did recover, and it also killed several people who became infected with it. What Jenner noticed, being a country physician who investigated a lot of people who lived out in the country and who had cow herds, was that the milkmaids who lived in some of these country areas who had contracted a disease called cowpox, which is similar to smallpox, but it's spread from cows to humans, and it's not nearly as deadly or as dangerous as smallpox. What Jenner noticed was that the milkmaids who contracted cowpox were immune to smallpox. This made Jenner think, maybe the key is to actually give people cowpox, and this would keep them from getting the far more deadly disease smallpox. So he did something that in the year 2020 would be highly unethical, something that would never be allowed to be done. He actually exposed a young English country boy to cowpox. He actually rubbed a cowpox scab on the abraded skin of this young boy to give him cowpox. And it turns out that, the boy got a mild case of cowpox, but then he never received smallpox. So this was the first use of what we call a vaccination to protect against smallpox. So of course the antigens in cowpox were given into an injectable form, and next thing you know, the smallpox epidemic was on its way out. In the 19th century, vaccination became widespread, and in fact, in the year 1980, there were no more in the wild, in nature, cases of smallpox on Earth. There are still vials of smallpox virus that live on in some highly restricted biological safety labs in Russia and the United States, but as of right now, it's no longer considered a disease in the wild. So now as we head into the 19th century or the 1800s in the Western world, There was a little bit of a step back in health during this time because of industrialization. The quest for power and profit and to try to industrialize both the old world and the new world societies in North America led to deplorable conditions and widespread disease. There were very unsafe working conditions, very unsafe living conditions in some of the new populated towns that sprung up, particularly on the east coast of the United States. There started to be causation debates about, okay, we crowded all these people together, they got sick. What is it that made them sick, other than just, being in a filthy, crowded building? There started to be the idea of applying deductive logic and epidemiology to some of these problems. This is where we learned a lot of information about cholera from the work of Sir John Snow, and about typhoid from William Budd. We'll get into those in a little bit more detail in a second. With industrialization came a movement of social reform, this idea that we don't have to live like this, that living in these dirty conditions, battling disease, working in these unsafe work environments. Social reforms meant that the government took an increased role in public health and health in general. The first sanitary legislation came out in the 1800s. These were laws that sort of dictated that municipalities had to do something with their garbage, for example. You couldn't just have people dumping both their garbage and their night soil, which is what we call the things they emptied out of their chamber pots, out into the street. That things had to be done differently. There was a focus on hygiene, on child welfare, on the aged and the mentally ill. And the fact is, social reform was needed because the population in several of these 19th century areas was building up too quickly for existing food supplies and existing sanitation infrastructure. So this is just kind of a photo record of what urban life, particularly in the eastern United States and in Western Europe, was like in the mid-19th century. Again, the streets were very fouled. There was pathogens probably everywhere you looked. And when you went inside some of the workplaces, they were crowded. They were unsafe. Again, this is a meat processing plant you see down here at the bottom. You would imagine that the meat being processed in that plant is also not terribly good for you based on the conditions where it's being processed. And you'd be right. So now let's talk again about another one of the pioneers of epidemiology, also from England. First, we'll talk about the condition that first was brought to his attention: cholera. Cholera is an acute diarrheal illness caused by infection of the intestine with the bacterium Vibrio cholera. We know now that it's Vibrio cholera bacteria that causes it. Back in the time of John Snow, this wasn't necessarily known. Approximately 1 in 20 infected persons, that ingest Vibrio cholera, will have a severe disease characterized by profuse watery diarrhea, vomiting, and leg cramps. And of course, unfortunately, that profuse watery diarrhea will often contain high levels of the Vibrio cholera bacteria, so that if proper sewage disposal does not occur, this can actually contaminate other people's drinking water, and so therefore cholera can spread in an area of contaminated water supply very quickly. When you have cholera, you also rapidly lose body fluids, which can lead to dehydration and shock. Without treatment, death can occur within hours. So now, in 1850s London, John Snow was a physician who was skeptical of the miasma theory for how cholera transmitted itself. And he took special interest in the London epidemic near Piccadilly Circus, again around the years 1852 to 1854. When John Snow first went to investigate this, it was kind of personal to him. He was a founding member of the London Epidemiological Society. He was somebody that lived in the area, and he wanted to get to the bottom of this. He didn't just believe it was miasma theory. So he investigated this cholera outbreak. On the first 10 days of September of this outbreak, over 500 people had died of cholera. What John Snow did was he mapped where all these people who had gotten sick, and for those who had died, he talked to the survivors of those who had died, tried to find out where did they get their water from. What he found was that water from one particular pump the Broad Street pump, now known as Broadwick Street if you went to London today, he determined that the water at that pump must have been contaminated because it was something that nearly every person infected had in common. He had convinced authorities that this was the source. Again, it took a lot of convincing. There's still a lot of belief in the miasma theory, the idea that poor people were just inherently more prone to disease or things like that, but the epidemic ended after the pump handle of the Broad Street pump was removed, so that was, again, very good evidence that he had figured it out. Of course, he didn't know about Vibrio cholera. They didn't know anything about the bacterial or pathogenic cause of cholera. He just knew that this one water source appeared to be a commonality of all the exposures, and he was right. What this knowledge led to was improvements in water filtration and also support for germ theory. Again, the idea that it's microbes spread in various ways that cause disease states. It's not miasma, or it's not because poor people lack moral fiber, or a lot of the other ridiculous ideas that now these days seem ridiculous, but that were thought to be the reasons for disease states back then. And again, this was 30 years before Vibrio cholera, the bacteria itself, was discovered and isolated. This is the map of the affected area. You see Piccadilly Circus at the bottom, and almost in the very middle of the map, at the intersection of Broad and Lexington Streets, you see that letter P with a circle around it. That was the Broad Street pump. The dots on the map indicate cases of cholera, either those who got cholera and survived, or those who got cholera and died, and then from interviewing their survivors and relatives, John Snow figured out where they had lived. As you can see, some people that got cholera, they actually had closer pumps that they could have used, but from interviews, it turned out there was, for various different reasons, every one of those people represented on that dot on the map had access to water from that Broad Street pump, either directly from drinking it or indirectly by being in somebody's household who was cooking with it or serving you it or something like that. So, yeah, it was, but if you looked at the cluster, it's pretty obvious where the most likely source of this outbreak was. But this was the kind of applied epidemiology that before John Snow, nobody had really done. Before we talk about William Budd's contribution to epidemiology and the history of public health, we have to talk about the disease that he went to battle against, typhoid. It's caused by a bacterium. We know that now. Salmonella typhi was not necessarily known back in the mid-1800s. Typhoid is still common in the developing world. It comes from food and water contaminated by sewage. Characterizations of typhoid include fever, headache, constipation, malaise, chills, and muscle pains. The death rates for typhoid, if you get infected, range between 12 and 30%, and the illness can last for 3 to 4 weeks. It's a pretty painful and debilitating illness to have, even if you survive it. So at roughly the same time that John Snow was investigating cholera, William Budd was investigating a typhoid fever outbreak. He also was an English physician. He traced the source of the typhoid outbreak to waste from an infected person that had been disposed near a well. Of course, that waste from the infected person, we shed Salmonella typhi bacteria in our feces when we were infected with typhoid. This waste had apparently managed to infiltrate the nearby drinking well. Because of the sort of the primitive brick infrastructure that existed in many cities back in that time, it was very easy to see how if you dispose of something near a well, there's a pretty good chance it's going to wind up in the well. From these observations, Budd concluded that water was the vehicle of transmission for typhoid, and this led to much of the classic work on waterborne transmission of infectious diseases, and again, preventive disinfection of public water systems. Thankfully today now, we have a lot more protection for our water systems, not just keeping them isolated from pathogens in the first place, but also putting biocides and other things in our water systems so that if pathogens do make it into the water system, they can be quickly inactivated or killed. We should also acknowledge the valuable public health historical contributions of Florence Nightingale. Again, she was an English nurse. She actually came from an upper-class family, but rather than deciding to get married and live the normal social and societal life that would be expected of someone from her class, she decided she wanted to become a nurse instead. And so she pursued nursing education. And then during the Crimean War in the mid-1850s, she and a team of nurses were pretty horrified to see the unsanitary conditions at British base hospitals, where many of the British soldiers who'd gotten wounded on the Crimean War front were brought back to be treated. And unfortunately, being brought back to these base hospitals was probably, these soldiers probably would have been better off just being left where they were, because these British base hospitals were a place where a lot of people died, not from battle wounds, but from infectious diseases such as cholera and typhoid, due to the conditions that existed at these base hospitals. These soldiers were generally not changed out of their clothing that had blood and other war wounds in it. They were kept, rather than in elevated cots, they were put on the floors of these hospitals so that they were exposed to rats and other pests. And so a lot of infections occurred, a lot of infectious diseases as well, along with sepsis. So Florence Nightingale and her team of nurses did some dramatic things to improve the sanitary conditions of these base hospitals. First of all, they advocated that every soldier that came in get put on a cot, elevated up off the ground, that they get changed out of their dirty, probably soiled with both blood and fecal matter, out of their soiled battle clothing and into clean gowns. And it's just some really basic precautions that it's hard to imagine that this was not being done as recently as the mid-1850s, but that it was not being done. So she wrote of these experiences of how you reduced the death count in the base hospitals by 2/3. She wrote of these experiences, and her writings helped to improve sanitary conditions at hospitals worldwide. So even though she would have probably referred to herself as a nurse and not an epidemiologist, she also was a very important epidemiologist. So much of the history of public health and health that I went over took place in the sort of the old Western world, the former Roman Empire and England and the United Kingdom. What happened in the United States? Well, in the area of pre-contact, before Columbus came to the Americas, a lot of the indigenous people of the Americas practiced various forms of indigenous medicine. Again, people like the Mayans actually had some pretty advanced ideas of how to treat different conditions, and they used food as medicine as well. Once contact came with European settlers, there was a lot of what's called virgin soil epidemics, meaning that first contact of people that had never been in contact with each other before. Unfortunately, this first contact led to about 90% of the indigenous population of the United States in particular dying of conditions such as cholera and smallpox, from which they had no immunity. In the colonial period of the United States, some of the early settlements made by white settlers coming from Europe were actually decimated by diseases as well, because it went two ways. There were conditions for which some of the native indigenous people had built up immunity over many generations, but which people settling in from Europe had no immunity whatsoever. After the American Revolution, there were a lot of exotic diseases that began to come to the U.S. and Canada as a result of trade with this new country. Because of these exotic diseases, from many of the places that the U.S. was trading with, health boards and harbor control started to come into play. This was really the start of public health in the United States. A lot of times, if a ship was coming in from, say, China, with some goods that some of the early towns in the U.S. wanted, that ship would have to stay in quarantine for 14 days off of the dock, so that everyone in it could be certified as healthy before they would be allowed to dock. So that's an example of harbor control, and that one of the first things that was done for public health in the United States. As public health began to emerge in the United States in the 1700s or the 18th century, there was increased populations because of migration and also because of natural natality. But there were also new health threats, again, because of trade, because of some of the deplorable conditions in some of the slums, particularly in the eastern United States. There were a lot of unscientific remedies that were proposed for some of the things that ailed people, and generally a low quality of medical care. In the 1800s, there was some improvements because there were more health boards and health departments formed at the city and county and state level. There were separate rural and urban strategies that began to be developed for dealing with some of the population-wide community health problems that were happening. The American Public Health Association was actually founded in the year 1872 and continues to be a great advocate for public health in the United States. In the U.S., most of the advances in public health that we know of now actually occurred in the 20th century, or the 1900s. This is when the first schools of public health began to emerge. The first one was at Johns Hopkins University in the year 1916, so that young people could actually go and study public health as a discipline, and in the hopes of going into public health as a career field. The UNLV School of Public Health was formed in 2005, so almost 90 years after Johns Hopkins was formed. But in those 15 years since, it's become a very productive and very good source of public health professionals and data and expertise in Southern Nevada and beyond. In the 20th century, we saw advances in epidemiology and surveillance. In other words, we could actually sort of nip outbreaks in the bud through surveillance of knowing quickly that something is going on in a particular community or particular region. So we could send resources there, we could send medicine there, we can send expertise there, and maybe stop something that's happening in one community from spreading all across the seaboard or the state or the globe. We started doing standardized health surveys in the 20th century. These were good because it helped us track health and other outcomes of Americans through time. So we could know that, is the rate of whatever infectious disease, sexually transmitted disease, cancer, whatever it is, we can kind of track the progress of these things in the population over time. The National Institutes of Health was formed in 1912. The Centers for Disease Control and the Prevention and the Food and Drug Administration were formed in the 1940s. And one of the most influential writings of public health in the 20th century that's really formed a lot of our modern public health is the Institute of Medicine report, The Future of Public Health, from the year 1988. Some of the great 20th century achievements in public health include the following. This is not an all-inclusive list, but it's a list of some of the most major ones. Vaccinations to prevent illnesses and antibiotics to treat illnesses if you get them. We advanced a lot in both of those in the 20th century, so that control of infectious disease began to occur. Many of the deadly infectious diseases of the early 20th century and the 19th century, we started to get a hold of them, again, because of a combination of medicine and public health. We improved maternal and child health, so that children were less likely to die in their first year of life, and moms were a lot less likely to die in childbirth. In the 20th century, motor vehicles were invented, and then we recognized the carnage that was resulting from motor vehicle collisions and some of the and poor training of drivers and poor road conditions and many of the other things. And so, starting in about the mid-1950s, a lot of great improvements occurred in motor vehicle safety. Some of the safer roads we have now, and things like seat belts and radial tires and airbags. These all came about in the 20th century. Safer workplaces. The Occupational Safety and Health Administration was founded in the year 1970, and we actually have reasonably stringent regulations on safety in workplaces. Now, that being said, there's still plenty of people that get injured and die at work, even in the year 2020. We still have a long ways to go, but workplaces are definitely safer than they were at the turn of the 20th century. We've improved food and water safety thanks to the work of the Food and Drug Administration, several local health departments, and also the industry. You're a lot less likely to get sick from the water coming out of your tap, or the foods that you buy at a grocery store, or that you get served at a restaurant, compared to 100 years ago. We started fluoridating the water supply. By doing so, we've helped reduce the number of cavities and dental caries that people get, which if you get cavities and dental caries, especially early on in life, it often leads to other negative health outcomes as a result of poor dentition. So putting fluoride in our drinking water is another great achievement from the 20th century. One of the downsides about all of our great progress we made on public health in the 20th century is that by the time you get to the latter part of the 20th century, like the early 1980s, people were starting to take public health for granted. Most people in the United States no longer feared infectious diseases or feared unsafe working conditions or unsafe food or things like that. They just kind of assumed that everything was safe and started to take it for granted. So public health started to kind of lose some of the expenditures that were being given to it through government. And a lot of governmental health expenditures started being directed toward individualized medical care rather than toward public health. In fact, nobody was really talking about public health. And so a lot of our health departments kind of started to wither, and a lot of our surveillance systems were weakened. Well, life kind of has a way of snapping us out of complacency. And unfortunately, in my lifetime, there have been a few very large-scale events that have affected people here in the United States that have renewed public interest in public health and support of public health. One of those occurred in the early 1980s, the AIDS pandemic. There was a lot of, in the year 1980, you probably could not have convinced the average American that there would be a new infectious disease emerge that would be such a widespread threat. There would be assumption that, oh, we got that, that's not a problem anymore. But then the AIDS pandemic came along to shake us all out of our complacency. After the 9/11 terrorist attacks, there was another very, thankfully not as dramatic and that didn't kill as many people, but still caused a lot of anxiety in our society. And that was some bioterrorism attacks where anthrax spores were put into mail and sent to many elected officials. And so this got a lot of other people scared about the idea of like, well, we need to tighten up our public health infrastructure to make sure that bioterrorism is not a threat to us. And of course, as I speak to you right now in August and September of 2020, we're in the midst of the COVID-19 pandemic, where a viral infectious disease is causing great havoc. It's unfortunately causing 170,000 deaths and counting in the United States, with not necessarily an end in sight. To prevent COVID transmission, we've had to have our lives severely disrupted. So again, the complacency about public health kind of ended by the early 1980s, starting with the AIDS pandemic. But then what happens is we get a handle on one thing, people get complacent, and then the next thing comes along. And unfortunately, right now, that thing is COVID-19. My hope is that once the acute crisis of COVID-19 is past, that we will actually keep these lessons of public health and what's important in mind, and that we will continue to fund public health to the degree that it needs to be funded. That's my hope anyway. So if you have any questions or concerns about any things I went over with, things I've gone over today about a brief history of public health, you can bring those concerns to our next in-person class session, or you can send me a direct message, whatever works for you. In the meantime, stay safe, be well.